Hello and good afternoon. I'm just going to wait a few minutes for everybody to trickle in, but you are at the Outbreak, Managing the Outbreak, Lessons Learned from BC First Nations webinar brought to you by the First Nations Public Service Secretariat. I think we're expecting about 200 people today, so I will just wait a few minutes before I get started with our introductions.
They're going to talk about it at 1 o'clock.
I'm going to run through a couple of things. Some of this webinar will be Q&A. So in order to submit your questions, we have 4 panelists here with us today to answer your questions regarding COVID-19 outbreaks in First Nation communities. To submit your question, use that Q&A button at the bottom of your screen. You can see all the other questions that other people have submitted. You can upvote them if it's a really great question and you want to ensure that we answer it before the end of the webinar. There's also a group chat option where you can send messages to the panelists, to myself, so that everybody can see it. So please use that too as well if you want to engage with us. We have about 67 people here so far. If we can, thanks, Erik. All right, I'm going to go ahead and get started. Like I said, welcome to another First Nations Public Service Secretariat webinar. Today is webinar Tuesday. We typically do these on Wednesday. So we are going to be talking about lessons learned from our BC First Nations here that have experienced an outbreak, COVID-19 outbreak in their communities. My name is Selena Dorme. I'm the engagement coordinator here at the First Nations Public Service Secretariat. I'm also from the Tla'amin Nation here in North Vancouver, but I also like to recognize neighboring nations also on this unceded territory of the Musqueam and the Squamish peoples. For today's webinar, we have 4 panelists with us today. This is going to be a 1-hour session. We have Kyle Marshall, the EOC Director, EOC Director, Chris Lewis, Councillor and Spokesperson for Squamish Nation, Erik Blaney, Fire Chief for Tla'amin Nation, and Shannon Alfred, Health and Safety Manager with Namgis First Nation. So thank you all for joining us today. I really appreciate you taking the time to participate on this webinar and share your experience with other First Nations that are probably currently dealing with a COVID-19 outbreak in their communities. I believe we're going to get started with Shannon Alfred from Namgis First Nation. So we can have everybody else turn off their video and their audio, and we're going to go ahead and hand it over to Shannon.
Gela Kasla. Nugo Amalakila Ugwa Ayiklen Lach Tito Wallakami Namgis. I'm Shannon Alfred. I live in Alert Bay, located on Cormorant Island, in the traditional territory of the Namgis, my ancestors. What I like to share is what worked for us. And what worked for us at the beginning was we had a pandemic influenza preparedness plan that was developed in 2005, was updated in 2012, and then again on March 2020. From that, we set up our EOC ahead of time to collect information, resources that are in our community as well as our neighboring communities. We also had a health lead team at the time, and in partnership with our Cormorant Island Health Center, which is also known as our hospital. And prior to COVID hitting our island, we had a test site that was set up by Island Health. We also had identified 2 buildings in our community that would allow for community members who couldn't self-isolate at home be able to self-isolate if they couldn't do that. And then at that we would be able to require food and any other essential services to them. We also had, prior to COVID, we had pre-EOC training level 1 and 2 in 2018 and 19, as well as in 2019, we had 2 tsunami sirens installed in our community. During the COVID outbreak, we ended up having 30 cases on our island, and we were on daily calls with EMBC. And during that outbreak, as the COVID was spreading, the Alert Bay municipality, with the support of the medical health officer, declared a state of local emergency. And then Namgis implemented the curfew to help support the limited movement of travel to and from our island, in collaboration with BC Ferries and the conservation officers that came with that during our SOL outbreak, SOL, which is the state of local emergency. We weren't up to enforcing anyone to stay put. What we wanted was from the Tri-Authority was to encourage people to stay put and to give that educational piece that, hey, we're in a pandemic. We need to really encourage everyone to stay put so that we could get over, manage this better and have it gone from our community. So with that, when the curfew was implemented, we also had 2 safety ambassadors that were hired to monitor, observe, and report back to the EOC. The conservation officers, we had one in Port McNeill and one in Alert Bay, and really it was just letting community members know that if you leave the island without a pass to be able to get back on, you may not be able to return to the community. So we had another one on the other side within the conservation officer there was given an update list on a daily basis so that he would know ahead of time who had pre-approved to come back to the island. We also had a direct line to the EOC for community members that had any issues or concerns. So we really encourage people to phone in if there was anything that was of concern or issue, so that we could manage that and direct it to the appropriate places. And what worked for us was also having the Indigenous Service Canada funding to help with the COVID response. And just as a way of ensuring that we're keeping community members safe as much as possible. Some of the challenges we had was that even though we had previous trained members in the EOC, a lot of them were in the high risk category and decided to stay home, which was a challenge because now I was looking for people to staff the EOC. So we had 4 Namgis employees step up to work in the EOC with no prior experience, but the work that they did was really helpful and was part of the success to us managing COVID better. EOC during the outbreak, once we heard that there was an outbreak, we did try to self-isolate our EOC working from home and limited Wi-Fi accessibility to our island. The daily tasks were starting to pile up and it just wasn't working for us to self-isolate at home. So we went back to the EOC. The 2 buildings that we had previously identified was more focused and geared towards families. And so part of the challenge was that we didn't think of was looking at the people who were homeless, couch surfing, and heavy into their addictions. So it was hard for them to just stay in one spot. However, with that, we were able to have commercial accommodations. So working with the local businesses, that they were able to provide us with a number of rooms that were specific for self-isolation. And so we were able to do that. However, the challenge with that was that there was no form of communication in any of those rooms, where if anyone was in there, they wouldn't be able to, the local nurses or Island Health wouldn't be able to do their daily check-ins. With that, with the limited amount of staffing in our ELCs, fatigueness and stress started to set in, and we just had lack of EOC staffing capacity at the time. We also had one of the challenge in our EOC was that we have a wireless printer, and that was just an ongoing technical glitch. We couldn't get it working, so that it just provided more work of having to go into somebody else's office and try to get things printed off. And with our small group, we were doing, or the challenge was getting large orders of food distributed to our island. And when the freight came in, it was just our small group in the EOC that was coordinating, sorting, and organizing food hampers to go to 234 homes on the reserve. And then another challenge was losing our loved ones before COVID hit and during. And so it put an emotional toll on our community, because we just weren't, our people just weren't able to put them to rest right away. And so that was an emotional toll on our community. Some of the recommendations I came up with or thought of, or in collaboration with the other group, was that our Tri-Authority, we're in a unique situation where we have the municipality, the Namgis First Nation, as well as the Wheatlalayu Area Council. And then we have the Regional District of Mount Waddington, but more so the Tri-Authority on the island. So each one has different areas of budgeting and following guidelines. What emergency management is for them to develop on an agreed management strategy and framework to better guide the EOC, develop policies, guidelines, and procedures that would allow things to flow more better and effectively. I would also recommend yearly or when required, local authority training so that our local authorities know their role and responsibilities. And then again, yearly training on EOC. However, with more geared, if we can encourage the younger population to want to get involved in the emergency management. Also to build on and then that would build on the EOC staff capacity. Also, we started off well with our health leads and representative, but when things became overwhelmed, we lost that connection in keeping us updated. So I would recommend a health lead provide the EOC with daily updates, or have someone in the EOC that could they could communicate so that there's one person and not 5 or 10. Also have a pre-list of volunteers with contact numbers, and allow for unrestricted funding to purchase necessary EOC and ESS equipment. Pretty much that's some of what I have.
Thank you so much, Shannon, for sharing all the good work that you've been doing so far to address the pandemic in your community. I just want to reiterate, and now that there are more people that have joined the webinar, on how to submit your questions. We will get to everyone's questions after all the panelists have had a portion to speak and share. If you click the Q&A button at the bottom of your screen, you can type in your question. You can upvote somebody else's question or your own question if you want to ensure that it gets boosted to the top of the list, to ensure that we answer it. We also had a poll that was launched in the beginning of the webinar. So we've had 112 people respond, just 2 questions. We want to know which region you're from in the province, and if your community has had 1 or more positive cases of COVID-19. So if you see that in front of you, I'm going to close that in a couple of minutes. So if you don't mind filling out that poll, answering those questions when you get a chance. I'd like to now call on Kyle Marshall from Skidegate Band Council, the EOC Director. Kyle, can you turn on your video?
I can, Thanks. Yes. I may have to shut it off. My connection's not that great, but thank you very much. So I guess I'll start by saying how everyone for being here. As I was introduced, I am the EOC director or IC lead right now. Here in Skidegate, we got out of the gate fairly quickly, earlier than most. We started our EOC, we activated in March, well ahead of our outbreak. And this was to revisit our pandemic plan, our influenza pandemic plan, and other pandemic plans that we had within our local health authority. We were able to revisit and start to make adjustments ahead of time, just based on what we were seeing across the province as the pandemic made its way to us here in BC, which seemed to take quite a while. It was both a good thing, a blessing, and a curse. We were able to activate the EOC, activate volunteers within the operations center for things like food deliveries, prescription deliveries, information checkpoints. The curse was we started off so well, so fast, and we by the time our outbreak arrived here, we were all pretty tired, pretty burned out. So a little word of advice is to pace yourself. Look forward, look what's happening around the world, the rest of the province, across Canada. Make those arrangements ahead of time. You know, if it's not too late and you haven't experienced the outbreak, start your planning now. We were able to secure not only food, but personal protective equipment. Our main focus in Skidegate was to identify elders and vulnerable, make them a priority in our food services, delivery services, and also extracurricular things, setting up, you know, door-to-door bingo programs, things like that to keep them busy, keep their minds active. We realized very early on in the pandemic that there is a lot of past traumas that were stirred up, if you will, by this outbreak, by the pandemic, and we needed to address that very quickly. So that was done very well with the assistance and help from our local health authorities, both Northern Health and our First Nations Health Authority. Haida Gwaii is also unique in the sense that it's an island. We're connected by one common highway. You know, to get from Dudgeon Geets on the south end of Haida Gwaii to Masset, it's one highway passing through multiple communities and jurisdictions. We learned very early on jurisdictions were going to be an issue. Without a provincial order, the municipalities, regional district were limited on their authority to restrict travel, restrict movement within the community. Our two First Nations communities, Masset, our old Masset, and Skidegate, were very quick to, I guess, tighten the rope on our communities, let people know, you know, keep them informed very well. This is weekly brochures delivered door to door into everybody's mailbox, posted around the community. Let them know where we were with the outbreak, how serious it was, complications that may be coming. Just being very transparent with the communities. We also learned early on that it was very important to establish not only a unified command, which we used the Council of the Haida Nation to unify all the municipalities, regional district, and bands on the island into one manageable group where we could make decisions, hash out problems, discuss funding options, things of that nature amongst everybody that was involved here on the island. Unified command worked very well initially. It worked fantastic when the outbreak was declared here in Haida Gwaii. We were able to pool our resources and really come together with our wording and what we wanted the public to know as far as travel and restrictions to travel. But the moment the province lifted the outbreak here on Haida Gwaii, the municipalities, regional district had to go back to their resume, I guess, fall in with the province. Our two bands here on Haida Gwaii, we tried to stay 2 or 3 weeks behind the rest of the province just to kind of see how things played out and not overwhelm our services. It worked very well for us. Managing this as a unit, involving the public, involving municipalities, bands, and regional district all together, it worked very well for us. And again, as I said in the beginning, we really stretched ourselves thin by starting out so strong in March. By the time the outbreak got here, we were a well-oiled machine. All the systems were in place, but we were very fatigued. So there's another lesson there for everybody, and that is to make sure that you have a backup for your frontline people and make sure that your backup has a backup. It's very important to give people mental health breaks, you know, a week off, a few days off here and there. Have those resources ready, and remember to shadow your resources. If you have somebody, for instance, that's working in the operations level within the EOC, and that person is starting to wear down, you need to get a shadow to follow them for a week so they know the job, they understand the ins and outs, and when that person takes time off, their second in can take off where they left off. Very, very important lessons that we've learned. Again, you know, we made preparations early with food, even burial services. We went as far as to design and make sure that we had available to us the equipment to make outdoor crematoriums. We were preparing for the worst and hoping for the best. We had a lot of buy-in from our island residents. The communities really pulled together. When we asked people to remain indoors, they remained indoors. They complained about it. we heard it every day. My phone rang off the hook daily, and so did, you know, 10 other people from our emergency operations center. But people understood as well. There's a lot of fear around COVID. It's very important to keep the communication lines wide open. Give people a chance to call. Sometimes they just want to vent. We do have a very strong communications department and our liaison department who are able to answer questions and get newsletters put together at, it seems like, a moment's notice to get out to the community. Our big issue was travel to and from Haida Gwaii. We have 2 hospitals here, one north, one south. We have 2 ventilators on island. We were planning for several people to get sick, and in the end, our outbreak consisted of 26 sick individuals, and 52 in quarantine for the full 2 weeks. That's a fairly large number for us here. Fortunately, the ventilators were not needed, but and I hope they never are. But that was definitely something that was in the back of our mind, is just how quick one individual coming back home, not quite following the guidelines, affected so many people so quickly. Having buy-in from the community and support is extremely important. And the only way that's going to be accomplished is by transparency. So having good communications between your either unified command or your band and the public, and keeping them up to date. It is very hard with confidentiality guidelines and rules. People want to know who, why, when, where, and how. And realistically, we just need to reassure them that contact tracing is being done. You know that if they follow these guidelines that we have in place, the hand sanitization, the staying within your small bubble, your family bubble, things of this nature, we can get through this. And that's exactly what we did. And that is exactly what happened. We are still currently running information checkpoints. They were established at the very beginning of the pandemic in March when we organized our EOC. Initially, we trained about 30 people to work these information checkpoints. We very carefully worded our documents, and these checkpoints were for ferries and flight traffic coming to and from Haida Gwaii. And it was not to scare people away, but it was to inform them that we are a small island community. Any added pressure with tourism, hunters, fishermen is just going to be too much for us. The risk is too high. So we asked for respect for the traditional land of the Haida people. We asked for respect of the citizens here. And we also asked that, you know, these people return maybe when the pandemic is over. We were never forceful. A lot of folks that showed up here as tourists got off the ferry, they got to our information checkpoints, they were given the information, things were explained, and they actually turned around, went back to the ferry and renewed their ticket for the same day and left, which was fantastic. It was great for us. It's always hard to turn people away. We do rely heavily on tourism here. But I think they understood, and we understand the downside to having more people here on the island. So, I mean, overall, everything worked out great for us. We were able to get through this, come out the other side. There was a lot more that happened here, and I would be happy to speak individually to folks if they need to reach out.
Thank you so much, Kyle. Much appreciated. And having a backup for your backup is definitely great advice, even aside from pandemic. Backing up your backup is always a good idea. I'd like to now call on Chris Lewis, council member and spokesperson for the Squamish Nation.
Thank you very much, Selena. And I just want to thank the organizers for getting us all together. Hat Squal Tanoia, Siams, Si Talkton, Koshaman Snoskahotmish Okamil, just saying in the Skahotmish language. It's great to be with all of you today. And my ancestral name is Si Talkton, and I am from the Squamish Nation. I'll start off first about talking a little bit about the first wave in terms of what the nation did. We didn't get any cases during the first wave, but we really mobilized where we declared a state of emergency. We did food and supplies to all households and deliveries to all households. We closed the reserve down to visitors. We developed a work from home policy for our nation employees. And so the offices were bare bones in terms of just essential workers, all of those types of things. And we got through it with no cases. And then August 25th came, everybody kind of got relaxed over the summer months and all of those types of things. So on August 25th, the nation, our health director informed us of our first case in the community. 3 days later, the number climbed to 9 cases. We quickly closed our nation offices and facilities to just essential services, but we continued to run, noting that we had the work from home policy. It was largely contained to kind of one family, one household at that time. 2 days later, the cases were at 19. The anxiety started to really increase in the community because we're such a tight-knit community that you can kind of just see it spread through the networks. And that was the first day that the nation went live on Facebook to kind of really try to calm the community down and get us into a compassionate mode rather than a place of anger. Over the next 3 weeks from that, our numbers continued to climb both on the North Shore and in the Squamish Valley. We're currently at 43 cases total since August 25th. 35 of those 43 have been cleared by public health, leaving roughly 8 active cases in Squamish. We believe it's a little lower, but noting the infrequency now that we're thinking most of the cases have been cleared, but we just don't have the data at this point. From the onset of the cluster of cases, our staff quickly mobilized and all supports required for households were directed to self-isolate due to COVID-19. So all of the households and the people that were self-isolating, we did a whole wraparound services for them, providing groceries, prescription pickup, cleaning supplies, personal protective equipment. We really wanted to ensure that if someone was positive in a household, that we were also trying to protect the others in the household. And we all know as Indigenous people, multi-generations live in a house, and we really wanted to ensure that those most vulnerable, including our elders and our kids, were protected. We also assembled 710 community care packages to deliver to all of the households on reserve, along with 200 additional packages for our off-reserve members. Packages contained fresh, frozen, and non-perishable food items, as well as some activities to keep the families entertained while they were staying at home. As I mentioned, the early days were really scary for the community. Many of our members had a lot of uncertainty on what was to come. We aimed to mitigate these fears by providing clear, consistent communication through daily updates on Facebook Live and our website and email, and then also newsletters out to door, so that everybody was getting the information at the same time that we got the information, or the same day. I think it was really important to ensure that communication was top of mind. The reason why is you don't want your members reading in the newspaper about cases and increased cases. The strategy from the Squamish Nation was to give our members the information first and then talk to media if we wanted to talk to media. So we went from daily Facebook updates for the first month or so to 3 days a week, and now we're down to 1 day a week because the information from First Nations Health Authority and Vancouver Coastal Health is getting sporadic now because we're not in such a big cluster of cases in the community at this time. In relation to the question around how prepared were we, despite sharing all of the COVID-19 related information in the first wave and all the resources that we used in the first wave, and all the information we see daily on the news and on the TV, I don't think anybody in the nation was prepared on how quick the virus hit and how quick it spread. Our staff and leadership responded incredibly quickly, addressed areas of need, and provided support to those directly impacted by the virus, and also being very transparent with our communications, providing timely updates, communicating with the health authorities. And also some of our health staff were prepared in terms of pandemic response, but in terms of COVID-19, it was just across the nation's organization, we were lacking a comprehensive pandemic plan where we trained and practiced kind of what we would do. So it was really a learning experience for Squamish Nation and everyone involved as the virus spread really quickly. But in terms of the constant flow of information, we just really wanted to make sure that we were providing the information to our members as we received it as leadership. Due to the demographic issues of Squamish, I think mobility was a challenge to kind of lock down the communities and prevent people from coming and going. A lot of our reserves have multiple access and egress places, so it was really tough to kind of just put up a barrier because it wasn't just one road in, one road out. So it was really hard to restrict movement. We really relied on communications and empowering our members to kind of self-police their families and self-police their community to ensure that especially the young ones were kind of adhering to social distancing and all of those other aspects, and also encouraging all of those that weren't feeling well to get tested and to stay home. As I previously mentioned, we provided deliveries of groceries and other essential items to ensure that all of those in self-isolation were supported, and we weren't giving them an excuse to kind of go out and get groceries, that we were bringing things to them. As the previous speaker mentioned, confidentiality is really important. As you know, in our communities, people want to know who has it and all of those types of things. We were really straight with our community members to say that we don't get the names of people with positive cases. It's up to those individuals to reach out to the nation for support, which largely a lot of them did. But it also ensured the confidentiality of those people that were in self-isolation and possibly had a positive case. Transportation as well was really challenging at times in terms of transportation needs for elders. But we did work with the First Nations Health Authority, and they did provide us some support in terms of transportation around our self-isolating members. It's as simple as getting someone that should be tested to a testing spot. How do we get them? Because some of our people don't have cars. Do they catch a taxi? How do they get there? It was real simple things like that that we needed to mobilize on. In terms of our partners that supported the community, Vancouver Coastal Health and First Nations Health Authority have been instrumental in terms of providing our community with timely information, in particular when we were in the height of the cluster of cases. Staff from the First Nations Health Authority were in constant contact with our health department, answering questions and providing support through their experiences with other communities. We also had supports through EMBC and Indigenous Services Canada, and they provided us funding to ensure that there was income assistance top-ups, EOC supports, and ensuring that we were talking to the proper people. We also had a huge outpouring of support from First Nations such as Namgis and Haida Gwaii, and our neighbors Tsleil-Waututh and Hamusqueam and other nations and other First Nations leaders just reaching out. And noting that we're connected to the Kwakwaka'wakw and the Haida people through marriage and through kinship, it really warmed everybody's hearts that there was other First Nations communities sending love and prayers, sending their thoughts and their best wishes and their best practices to Squamish. It makes you feel that you're not alone in that battle. So I really want to commend the leadership and from Namgis and Haida Gwaii and other places. We also had a number of community supports and business partners that reached out with donations and PPE and in-kind support. People came to help deliver food supplies and all of those other aspects in terms of that. In terms of recommendations, I would tell everybody on the call, establish the response team and structure the EOC center as soon as possible, including everyone's responsibilities on that team. Ensure that the plan connects to the Emergency Management BC through the EOC and make sure the process is understood by everybody. Understand who the external agencies are that you'll need to connect with and keep in connect with and the key contacts there. Because you don't want people just calling all around. You want to ensure that there's points of contact within the nation and outside of the nation. And understand before the event or an outbreak in your community what leadership wants and what leadership wants to accomplish regarding COVID supports. When the first outbreak happened, our council was on break. So we all had to kind of come out of break and try to figure out what was happening. And I really want to commend my council for doing that. But it would have been great if we had all of that information ahead of time so that we could respond even quicker. Have a safety plan in place for all your programs in your buildings. As mentioned, have a plan for burnout. A lot of our staff were burnt out. Everybody was going 100 miles an hour. And then when you get out of it and you go back to regular work, everybody's tired and you can't get back to normalcy for quite some time. And also have a plan to work remotely and ensure that technology and resources are there for all your staff and especially your EOC members, and ensure that basic health protocols are being followed in the community. Be repetitive in your communications. I think I was on Facebook Live saying the same thing for like days and days and out, but it has to be that way. And when you need help, ask for it. Reach out for help. And like I mentioned at the top, communications is key. Be open, be timely. Get in front of the rumorville or anything of that. You know how our communities work is that we need to ensure that we're in front of the gossip out there and ensuring that we're supplying the facts to relieve the anxiety within the community and really support the community and show that compassion. So those are my thoughts, Selena. Thank you very much.
Thank you so much, Chris. Much appreciated. I'd like next to call on Erik Blaney, Fire Chief for the Tla'amin Nation. Hi, Erik.
Hello. My traditional name is Tiapthot, and my English name is Erik Blaney. I'm from the Tla'amin Nation, and I'm the current fire chief for the nation. And I also work for the Tla'amin Tribal Council as the Emergency Services Advisor. During our pandemic or our outbreak, which was what I'm told is one of the largest outbreaks per capita in Canada, I played the role of the operations section chief as well as the incident commander. So I did a lot of the boots on the ground response for our nation. I'd like to thank all of the other nations who shared with us previously through these webinars some of their lessons learned. It really helped us in our response with our outbreak here in our community. We've got a lot of lessons learned. We are still in this right now. We still have 37 active cases in the community. We still have some people in the hospital, so I'd like to send some thoughts and prayers out to those folks right now. Ours began with some folks coming in from out of the community, likely. There was a couple of, after Labor Day weekend, there was a wedding to the north of our village, a wedding to the south, and we had a funeral within our community. So it looked like we had likely some cases before the first one popped up. So the first person was symptomatic on a Friday, and they messaged me on Saturday and said that they had some symptoms. And on Sunday, their test results came back as positive. So at that point in time, they had put me in touch with their contact tracing contact. And we went over the funeral, some of the protocols that were followed and some of the protocols that were broken. And a lot of people let their guard down at this funeral. And by letting their guard down, the virus seemed to spread very quickly throughout the community. So of course, everything happens on a Sunday, and we weren't able to get a hold of any of our leadership within the community. So we were trying to get some rapid information out. And I think that's probably one of the biggest learning lessons for us right now is how to be quick in making a lot of your decisions that could protect a lot of lives. So I give a lot of credit to the first person who reached out, because she ended up making a public post on Facebook saying that she had tested positive, and she encouraged everybody else at that funeral to go and get tested. So that kick-started us into a Monday morning emergency meeting with the Chief and Council here, which is now a legislator, and Hagoose. We are a modern treaty nation. And the decision was to lock down the community based on the information from contact tracing and BCH due to the large gathering that happened. So logs were placed across the roads with LED flares, and we locked the community down as of 5 o'clock on Monday while we figured out some contact tracing and figured out who needed to go in to get tested. So by Monday, I believe our case numbers were at about 22. By Tuesday, they were at 24. So they just kept climbing throughout the week. A lot of the things that we had set up in the first 24 hours was a checkpoint. So that was to assist with contact tracing. So we blocked all the roads into the community. There was one way in, one way out. We were tracking anybody who was coming into the community. The community was on lockdown, and we had a curfew of 9 p.m. Once we had that in place, the community was closed to any outside visitors. So anybody who was delivering groceries to the community had to deliver that to the checkpoint, and we would then deliver those groceries or medications from the checkpoint to people's houses. It was a bit of a mess getting set up. Like you said previously about the Rumorville, Paul River is a isolated community, so we might as well be on an island. You have to catch a ferry to get in or out. So we had a number of concerns with surge capacity, looking at the number of cases that we had, as well as the possible number of cases in Paul River, knowing that the Paul River General Hospital only has 4 ventilators, and any COVID patients were likely going to be flown to Lionsgate Hospital. It posed a lot of questions from our community members on, how their family members were going to get back from Vancouver. So transportation became a large issue. And then we had the smoke roll in. So the smoke from the fires down in the south hampered any flights in or out. So the flights began to be about 50-50, and the helicopter couldn't land in the community anymore. Any of the folks being flown out to the hospital had to go by fixed wing airplane. which again only had a 50% chance of either landing or taking off. Access to food and goods was a challenge as well. We had a number of people step up, so I can say be prepared with your donations that are incoming, making sure that your donations are sanitized in, accounted for, and distributed out appropriately. A lot of people really stepped up to start bringing food out to people out here, and it became a pretty big logistical nightmare for our logistics team to get food deliveries to and from houses. Some of the other things that really helped us out were the in-community testing. So being part of Vancouver Coastal Health, there was a number of issues with getting information to our EOC and our leadership to make critical planning efforts within the community, as we weren't getting information. They weren't willing to share a lot of the information, and we still don't have any of the information on how many cases have been cleared out of the 37. So we're kind of just doing some basic math and talking to a lot of the nurses in the community on, you know, who's cleared, who's not cleared, and when does that number start to go down, and when do we start talking about how many recovered cases there are. So the First Nations Health Authority has been probably the biggest help in pushing Vancouver Coastal Health to try and get that information to us. It is very slow to get here, so our leadership is meeting right now to discuss on whether to lift our state of local emergency as of today. Another big win out of this is something that I've been working on as a fire chief for quite some time, which is harm reduction within the community. So within 24 hours of locking down the community, there were some people with some mental wellness and addiction issues that were having some issues to getting access to the items that they needed. So we worked with harm reduction team from Vancouver Coastal Health and others to set up a pop-up tent here in the community, and people had access to those needs delivered right to their doors. Housing was the other issue. So we are fortunate enough to own a hotel, and what we did is we set the hotel up in two different wings. So one wing was set up for people who were in quarantine. All of their meals were provided to them. And the other part of the hotel was set up for people who might have been fleeing domestic violence, or they just couldn't share their accommodations with other people in the home. So that was set up again within 24 hours of the first multiple cases that we saw. We ended up, again, you know, I think we were quite complacent in that we didn't get any cases in that first wave. We let our guard down. We weren't really prepared. We had a pandemic plan. We had a draft pandemic plan, a draft emergency plan that was done, that was shared with everybody and under review. The one thing that really hit us hard is that given the funeral was in the community, our EOC building, which is our gymnasium, the Sailors Center, the wake was held there. So we had no access to our commercial kitchen. We had no access to our community building. A number of people who work at the governance house were also at the funeral. So our governance house was possibly contaminated. So we lost all of our community buildings right away. We had no access to, you know, printers and photocopiers. A number of the vehicles as well that the nation owned also had to be decontaminated before they were used. So we relied pretty heavily on everything that the fire department had. And I know a lot of nations don't have a fire department, so it might be a little bit challenging. But we had a mobile command unit that we used with a printer and a laptop and radios and communications and lighting and flares. Again, don't let your guard down. Make sure your community has a really clear policy with your people in your communities on funeral protocols and gatherings. Also know that if your nation is looking at, helping some people with a funeral, to have all of the safety items in place, have hand cleaning stations, have, directional arrows on the floor. Make sure you have leadership there or somebody there that's kind of policing the event and making sure people are following the appropriate protocols that your nation is putting into place to keep everybody safe. We did some care packages for everybody in the community. So we have a community food bank. So we did shops every morning, and we have a community food bank that was set up, and we did deliveries out to the elderly and most vulnerable first. And we then fanned that out to families and everybody else. So some of the folks that we had that needed meals that couldn't cook, we had pre-made meals done for them. So all they had to do was put it in the microwave or the oven. Medication was the other one. We had to work with the local pharmacies to get medication to the checkpoint and distributed by a healthcare professional. So our community nurses were able to deliver medications to those who were sick. Transport issues were huge. So we do have vans, but getting access to any plexiglass to set the vans up to ensure the safety of the staff, of people who would be bringing people with symptoms to the test sites, was a major issue. That held us back by probably about 4 days or so. A lot of people were kind of scared to work and scared to do some at-risk activities. So really working with FNHA on some clear guidelines and policies around like garbage delivery. So people are now home 24 hours a day. Garbage started to stack up after about 3 or 4 days. So working with Vancouver Coastal Health to ensure that we had the best safe working procedures for our garbage pickup crews really helped put their minds at ease in going to collect garbage in the community, because garbage did pick up threefold when you have everybody at home. Sharing some messaging as well. So communications is huge. As a fire chief, my biggest concern is, okay, now we got people home for 24 hours a day, and now we have some people cooking meals who aren't used to cooking possibly, and people are cooped up. So making sure that you're keeping everybody safe when they're at home. And that's both physically and mentally. So a lot of mental wellness issues start popping up, a lot of depression. People, get pretty antsy after being locked up and cooped up in their house for a while. So communications, messaging, FNHA has some great webinars, some great YouTube videos to share and pass on to your community. I'd say be prepared and look at your emergency plan, but also prepare yourself with some of the harder issues that really came to the forefront for us, which were harm reduction, mental wellness and addiction issues, and housing and the overcrowding issues in some of the houses. Those were some of the toughest issues that we had to deal with in the community. And again, we were kind of battling this whole overdose epidemic prior to this this COVID epidemic. So I'd say be prepared to make those difficult decisions, because those will be pushed to the forefront in your response within your community. Having said that, I think that's it.
Okay, thanks so much, Erik. We're just about cutting into some of our Q&A time, so I definitely want to allow time for folks to ask questions. To submit your questions, use that Q&A button at the bottom of your screen. You can see that Kyle Marshall has responded to a number of questions that have been submitted there. So you can see you can read his responses in the answered column in the Q&A dialog box. So thank you so much, Kyle, for doing that. If I could have all of our panelists turn their videos back on, their audio, and we'll go to the questions that haven't been answered by Kyle. But thanks so much for doing that. I also want to mention that a few of our panelists are more than happy to chat with you after the webinar. If you want to have a fireside chat with them afterwards on a specific issue, we will leave their email in the group chat. They are more than happy to share. So thanks so much for doing that too as well. Do we have all of our panelists back? Shannon, if I can have you turn your video on. And Erik.
The host will have to turn it back on.
Oh, I'm sorry. I will do that right now. All right, so the first question is actually for Shannon. Since your community is remote like ours, how did you get your members out of the community since speedboat/ferry is main mode of transportation? Did any of them refuse to do it or use the taxi anyway?
The ferry remained the main source of transportation, and pretty much those traveling by water taxi was mostly those coming in from Kingham. That was what they were doing, was they were the taxi to bringing stuff into Kingham, and so they used our wharf, and we knew that, as well as Guildford. So it was more, the water taxis were delivering essential food sources to Guildford and Kingham, but there wasn't really anyone in the community that was just taking off. And most community members were in compliance with what was being asked.
Thanks so much for that. This next question is for Chris. How did you deal with staff that either have to self-isolate as a precaution or had confirmed cases in terms of their pay?
Yeah, thank you for the question. As I mentioned in my presentation, the Squamish Nation developed a work from home policy that kind of dealt with the ability to work from home. So those individuals that were just self-isolating as a result of maybe their colleague testing positive for 2 weeks were required to work from home, and the policy stated that the nation would provide them all of the materials so that they had the ability to work from home. For those individuals that were positive and tested positive and were not well, the nation continued to support them in terms of our COVID response. But then as it pertains to their work, it was treated like a sick day or something of that nature. And it was a little bit different depending on what department, but that work from home policy really kind of assisted as well in terms of supporting those members that were just self-isolating as a result of a family member or household member being positive. And then those that were tested positive were required to take sick leave or some sort of leave or go into their holiday bank.
Thank you so much, Chris, for responding to that question. And the next question is for Shannon. What is your advice to small, remote, isolated communities that are limited at outpost nursing stations in terms of following strict guidelines? There's a notion that because we are very remote, we're safer, or if not, advice on what is the best practice to ensure all community members follow the guidelines established and enforced by the EOC in collaboration with the nursing station.
Oh, wow. I think ahead of time, you're in a remote community is definitely wanting to ensure that you have information to community members about health and accessibility, and really getting ahead of it before time as to networking and making those partnerships. Yeah, that's one of the things. I can think of a couple of communities that are isolated, like Kingham and Guildford, and they've done a good job at really closing down their community. And really the only way that they could get to health is through their transportation would either be by water or air. So like helicopter would be a direct, and then also their airplane, float planes that go in there. And yeah, so really just having that connection and making those partnerships ahead of time, and working with health in some sort of way that if an outbreak occurs, then that they have that plan already in place of what their needs are going to be. Does that? I hope that answers the question. Yeah.
Thank you so much, Shannon. Appreciate that. The next question is for anyone to answer, and maybe this is forward thinking, but do any of your guidelines or policies address catering for meetings or events within COVID or during COVID? And this is going to be around for a really long time, I would assume. So has anybody done any forward planning on how to go forward with events?
I can sort of speak to, we have a couple of caterers on the island, and we don't have anything in place, but what I've noticed is that for smaller events, they have been doing what's required practices for COVID. So they're pre-packaging stuff, they're wearing masks, they're coming in with gloves, and then they're really, the ones that cater for usually big events are catering for much smaller events now, such as for meetings and any training that where physical distancing is required. So we don't have anything formal in place for the nation, but I know within the community there is some catering that's taking place, but definitely for smaller groups.
Thank you so much, Shannon. Anything else our panelists would like to add to that question?
Chris here from Squamish, just that's a whole body of work that needs to be done. Currently, noting that we still have active cases in our community. We're just trying to wrap our mind around how do we start reopening some of our community centers and dealing with funerals and community events and how those are going to be dealt with. So great question. It's still work that needs to be done at the Squamish front.
Yeah.
Thank you. Thank you both so much. The next question is, did any of you have any problems with hospital admissions and how your members were treated? Were they allowed visitors?
Yeah, ours hospital in Paul River was very good. They were open 24/7 to do any testing for any of our members, and you'd walk into the emergency and you would get tested right then and there. There is no visitors. There are no visitors allowed for any of the folks who had COVID. So what we had to do was designate a runner. So if they were picked up by ambulance, we would then pick up their stuff at their house in a tote in a pickup and get that to the nurse at the emergency. And they would take their items to them. So our hospital didn't allow any visitors. No.
Thank you, Eric. Anything else? Any of our other panelists?
Chris from Squamish here with Lionsgate Hospital. They were as well equally good with our members. No visitors. What they did tend to do on some cases was allow one visitor for 1 hour a day to visit our loved ones that were in the hospital. But that they would have to go in basically with a full, coverings and all that kind of stuff to ensure that they were safe. But that was kind of the only situation that I know of.
Thank you. All right, I'm going to move on to the next question. For any of you, were there any regional districts involved in how you supported your community members?
Yeah, so the regional district of Paul River, or the Cautet Regional District, they lead our regional EOC. So we have a tripartite agreement with the City of Paul River, the Regional District, and the Tla'amin Nation. So when we started getting burnt out after the first 4 or 5 days, we started to lean on the regional EOC. So we would send our status reports up to their logistics and information liaison, who would then assist us with our reporting and some of the paperwork. And they participated in some of our calls. So we did lean on the regional EOC from the regional district to participate, help us. They gave us some equipment as well, which was really helpful.
That's great. Thank you so much, Erik. Any other of our panelists want to add to that, or we can move on to the next question? All right, the next question is for Chris. What was different about the cases at Lionsgate Hospital that allowed visitors? Were they elders or had a different unique circumstance that they were allowed to have visitors as opposed to other people?
Yeah, I was just typing the answer there, but I'll answer it live here. Yeah, it was really unique situations. It was elders or those individuals that were kind of already immune compromised and then also palliative as well, where there was one visitor, but it was only like one designated visitor from the family. Like it couldn't change. Like it couldn't be just one, like it had to be the same visitor every day for 1 hour. It couldn't be one person this day and another person the other day. Like it would had to be like a spouse or a child or a family member, and it had to be just that one person. It couldn't be anybody else. So
thanks so much for that. I want to ask if any of our other panelists would like to add to any of the questions that had already been answered by Kyle. Kyle was being very diligent in responding and writing to all the questions. But I want to know if any of the other panelists would like to review those questions that have been answered by Kyle and add to any of them. You're more than welcome to do that. While you review those questions, Kyle, there was a follow-up question regarding curfew. So the first question was, how did you enforce your curfew? How effective was it? And you had responded, curfew was enforced by night watchmen, RCMP were helpful, but for the most part, people policed each other. There was a follow-up question to that. Were there consequences identified for your members to be aware of for them to comply with curfew, or was it basically just hoping people would govern themselves? Do you have to unmute, Kyle? Kyle, can you unmute?
There we go.
Yeah.
Try that again. So I think I can answer that for the most part. What I meant by people policing each other was, you know, of course, there's a lot of heckling. You know, we had one particular elder that I absolutely love and adore that was constantly on Facebook counting down the minutes before curfew, yelling at people on Facebook to go home and to get out. They can see him out walking around. And, you know, a lot of that was just lighthearted kidding. But, you know, for the most part, there was no enforcement really required. And I guess the result of having to enforce would have been simply, you know, lock down further. You know, we took these curfew measures to try and get through the outbreak, understanding that it was a short amount of time to get our numbers back down to zero. The quicker we do this, the quicker we get back to our everyday lives as normal as we can. And people understood that. They appreciated it. You know, there was a little bit of backlash in the beginning, but it was very short-lived because they understood the importance. And it's the reason why our outbreak, you know, lasted as short amount of time as it did. People knew the importance of getting into the home. It was the partying groups and the, you know, the big gatherings that we were trying to discourage, and we were very successful in doing that.
Thanks so much, Kyle. Is there anything else that our panelists would like to add? Oh, you know what? We just had like 5 more questions come in, so save that thought. So the next question is, where will this recording be, and will it be available for viewing? Yes, it will be available on the First Nations Public Service Secretariat web YouTube channel. And you could also find it, you can link to that through our website. There's a lot of tension towards the positive case and family members from other communities. How did you deal with just uneasiness amongst community members when somebody did get COVID within your communities? And that could be for any one of our panelists could answer that.
We really try to encourage people to just remember to be kind. These are family members. And it's not, it was really no one's fault. It's just something that happens. Like and I think there was a lot of fear and panic when it first hit our community. And we actually had our doctor, one of our physicians, come on Facebook and help alleviate some of that fear on that. And then we were able to follow that by sending out the messaging from our tri authority, our local leaders, that you know, it's here. We don't have time to blame anyone. We just got to do what we got to do to manage it to the best of our ability, and just do our due diligence in keeping people safe. And so the educational part of that, with the support of the physicians and health nurse, really helped to alleviate that. And we had to do a lot of that through Facebook messaging, video messaging, and I believe it really worked for our community.
Yeah, I would just like to echo Shannon's words. It's really about uplifting the compassionate words to those folks that have been impacted either by the virus or by self-isolation, and encouraging your members to hold their loved ones close, like, you know, support their loved ones and all of those other aspects. And really there was a lot of, I think as Kyle mentioned, there was people that just kind of came out, and Erik said this as well. People just came out and kind of self-declared that they tested positive. And there was outpourings of you know, love and compassion to those folks, and all of those types of things. And the community really wrapped their arms around the people and the families that were impacted. Of course, you always have the one or two people that are, you know, want to stir stuff and say things negative, but really it was drowned out by kind of the positive attitude. But it's really also in conjunction with the communications as well, that the nation in your EOC is putting out. I forgot to mention as well, we had to pull a couple of positive cases out of households, and put them in hotels so that they could actually recover without affecting anybody else, because they might have been living with grandma, grandpa, someone immune compromised. So we pulled them out very quickly and put them in a hotel and all that kind of stuff. And all of those little things kind of relieve the anxiety of the families and the communities around, knowing that the person, and you got to consistently kind of remind your community members and your nation members that the people that are supposed to be self-isolating are self-isolating. The people that are in quarantine are supposed to be there. Like, they're not wandering around and all those types of things, just to kind of relieve the anxiety. So thanks.
Thanks so much. Would any of our other panelists like to add to that?
We had a little bit of the opposite, in that we did have some people who had self-identified on Facebook that ended up wandering around later at night and breaking the curfew. So we actually did have to have some reinforcement come in from the RCMP to assist our Guardian Watchmen and our patrol in enforcing the curfew and getting some people to stay home. But what we saw after a lot of people did come out on Facebook and let the community know was just this really beautiful outpouring of support and words that were shared with them, thanking them for their transparency. And the greater community of Paul River really stepped up as well and thanked those people for being transparent, because a lot of folks in the community felt like they were in the dark when it came to, you know, is it here, is it not here, how many cases. So I think we had some both good and bad with respects to some community members doing the right thing or the wrong thing. But we dealt with that on a case-by-case basis. And having that really good relationship with the local RCMP really helped our situation out.
Thanks so much, Erik. It is 2:14 and we do have to wrap up. There's another webinar starting after this one, but I want to remind you all there will be a survey that will pop up once this meeting has ended. So please complete that survey. Of course, the recording of this webinar will be available on our YouTube channel, and there's a link to our YouTube channel in the group chat. And some of our panelists have offered to chat with you offline if should you have any direct questions with them on other specific issues. I want to thank all of our panelists today, and I raise my hands to all of you with the good work that you have done to ensure the safety of your community members during this very uncertain time. Thank you all so much for the great work that you do. That's it for today. Thank you all so much. Stay healthy and safe out there.
Yes.
Take care of yourself.
Thank you, Celine. Bye.
Thank you.
Bye.